Thank you so much, Osman, and colleagues, ladies and gentlemen. Let me bring you warm greetings from the Africa CDC. And I think this particular workshop actually coincides with the Africa CDC 5 years anniversary. We have the governing board of Africa CDC right here in Addis Ababa with all the political leadership of the African Union, celebrating the 5 years of establishment of Africa CDC, and also to define what do we do next. So colleagues, today we are looking at One Health research tool for preparedness and response to zoonotic outbreaks. That's what this workshop is all about. And for the next 2 days, we will try to unpack this. So first and foremost, for us at the Africa CDC, One Health is something that is key to what we do. Number 2, capacity building is also one of the key pillars of what we do as Africa CDC. So this will actually underscore why we are here today. And right from inception of Africa CDC, One Health has always been a top priority for us at the Africa CDC, a top agenda. And I know that long before now, it's been a lot of talk as far as One Health is concerned. So as Africa CDC, we are glad to see us walking the talk, moving beyond the normal talk and all those things that's taking place. So we are now moving into operationalization of the One Health. So I think this is a welcome development for us as Africa CDC. As part of the few lessons we've learned from COVID-19 pandemic is the fact that we need to scale up, we need to expand our workforce, and it's not just in terms of numbers, but it's also in terms of skills. So again, this being a capacity building exercise is also key, to what Africa CDC, seeks to achieve, as part of the lessons that we are being able to learn from this COVID-19 pandemic. The new public health order that Africa CDC is talking about, it's looking at one, strengthening health institutions. You cannot talk of strengthening health institutions when you don't have the right skill sets to drive those institutions. The second pillar under the new public health order is looking at how do we build public health workforce capacity on the continent. You will agree with me again that the RRTs have been critical as far as responding to this COVID-19 pandemic is concerned. In fact, one of the major tasks that was embarked upon by the African CDC when this COVID-19 pandemic started was to move rapid responders from Central Africa to West Africa to support the COVID-19 response. The third pillar under our new public health order emphasizes the importance of building our local manufacturing capacity. Again, you will agree with me that this is not achievable without the right skill set, the right workforce. And the last but not the least, which also emphasize or underscore the importance of what we are doing here today, is that of respected and action-oriented partnerships. We've been together with CHATHAM House for quite some time now with colleagues like Osman. Some of us have benefited from, the partnership arrangement. So it's good to see CHATHAM House, so we want to thank them. Of course, we also know that the UCL, they are part of this, so which also underscore the fourth pillar of Africa CDC new public health order, action-oriented partnership. And the colleagues from the Global Health Network and the other colleague from Oxford University, I think we acknowledge you, and we believe that this partnership is here to stay, and this is actually second in the series of training. So I'm sure we are going to have more trainings. So let me shift here and go back to the RRT. Currently, we have over 900 RRTs within the Africa CDC database, and for us, one of the biggest incentives to keep this roster functioning is to ensure that we have this kind of exercise that we are going to be embarking upon from today till tomorrow. Continue to build their skill set, and when you also look at One Health, and you marry that with the fact that more than 70% of most of the disease outbreak we are seeing today are actually of animal origin. So this further underscore the importance of what we are doing here today. So before I conclude, I would like to say that for Africa CDC, we continue to support, all sort of capacity building that will allow our member states to be at the forefront of their response. We want to see a sort of workforce, that will be able to respond first, and when they get overwhelmed, before they start inviting other people to join them. So in that regard, we are really quite appreciative of all the different partners who have put their heads together, starting from my colleagues from the Africa CDC, to colleagues at the Chatham House, to colleagues at the UCL, to colleagues at the UK Health Security Agency, and the Global Health Network. So we appreciate your effort, and we will surely look forward to receiving the outcome of this particular workshop, and jointly we co-create the next steps. Thank you, and over to you, Chair.